Hello, I'm Judy Couch, and I'm a family nurse practitioner at your wellness center. We specialize in hormone replacement here at the center. Recently, I was asked a pretty intriguing question, and it really was about hormones and how hormones relate to us when we deliver a baby after a pregnancy, and how hormones change us physically and also perhaps emotionally after we have a baby. And I thought it was a very interesting question because truthfully I think it's an area that there's a lot of information online about it, but I think it's even though that's true, I think it's an area that oftentimes is somewhat overlooked when someone is pregnant. When you're pregnant, a month-to-month update is usually done, and you know how your health is progressing and how the health of the baby is progressing, but very little discussion is done at that time to prepare you for the tremendous changes that you will have after the birth of the baby. One of the major things that happens and affects women both physically and emotionally is the tremendous drop in the hormones. Within 3 hours after the delivery of the baby and the delivery of the placenta, our estrogen and progesterone levels drop to nearly zero. In fact, those levels, when measured, will look very much like someone who is menopausal. This dramatic drop in the hormones can lead to a lot of symptoms, especially on the emotional spectrum for women. Many women might become weepy and irritable, depressed. Some of this is considered normal. These type of symptoms can peak by around the 4th day post-delivery of the baby, and usually should improve by around day 10. If they're lingering or worsening, we may become concerned about what has been termed postpartum depression. And there's a lot of things that can be done for that, and women should seek help if these symptoms continue to worsen or deepen. When we look at the complex changes of the hormones, there's 4 main hormones that are at play. And the first one, obviously, is the estrogen. And again, the estrogen during the pregnancy, the estrogen levels are at their highest that we will ever have. And the placenta is producing the estrogen, and to a small degree, the fetus. So after the delivery, this changes, and those levels immediately start dropping, and like I said before, become extremely low. Our estrogen is one of the hormones that actually guides our emotions and helps us feel stable emotionally. Along with the estrogen is the progesterone, and progesterone is definitely known to be a calming hormone in our female body. And again, after the delivery, post-delivery, in that first few days, the progesterone level comes down to nearly zero as well. And these things are supposed to happen. They're normal. It's the response of our bodies to the delivery. Those hormones were maintaining the pregnancy, but now that the pregnancy is over, those levels definitely need to change and start going back to our normal levels. 2 other hormones that are very important at this time are the hormone oxytocin and the hormone prolactin. The hormone oxytocin kicks in and increases close to the time of delivery. And this is necessary to have this happen because as soon as the delivery is over, the uterus will start contracting and will need to be continue to contract so that it can return back to its normal size. At the time of the delivery, the uterus will weigh approximately 2.2 pounds. By the end of the first 1 to 2 weeks, the uterus will hopefully be returned back to its normal size and its normal weight of about 2 ounces. So you can see that that's going to be a major change, and it could cause symptoms as a new mom and after the delivery. Because that change in the uterus, the downsizing of the uterus, so to speak, can cause cramping, and this can be quite painful and quite frustrating to the new mom who is adapting to life as a new mom with a new baby. So that is obviously, because of the hormones, a true physical change that you will note in your body. The other hormone is prolactin, and prolactin is necessary for breastfeeding to support the release of milk, to help our milk production. During the postpartum phase, although these hormones are necessary at this time, those levels can drop as well, again leading to some of the emotional symptoms that we might feel during that time. So the first week or so, it's normal. It's completely normal to have the emotional up and downs. One moment you may be euphoric with joy as you look at your new baby and the fact, and be very proud and happy that you were able to produce such a wonderful bundle of joy. The next moment, though, you may be feeling very overwhelmed and stressed and tired because of this new bundle of joy. So it can be a roller coaster of emotions, even within a few minutes of one another. So, be kind to yourself about it. It's normal. Again, though, I stress, if things are severe or long lasting, please make sure you seek the help of a medical provider, because there are things that can be done to help soothe some of the ups and downs that you may be feeling. Prolactin, as you're breastfeeding, can have a relaxing, calming effect. And because of that, the breastfeeding itself may help prevent the baby blues or the progression of the baby blues to postpartum depression. So just keep that in mind. But for women who elect not to breastfeed, those two hormone levels are going to drop pretty significantly too. So again, keeping that in mind. But the emotional roller coaster is not a reason to necessarily stop breastfeeding, and it's certainly not a reason to start if you have decided that you're going to use a bottle and formula to nourish your baby after its birth. Those four hormones are making other hormones change in our body too. For instance, prolactin can decrease our testosterone. Men at the time of the birth of a baby actually have increased prolactin levels in their bodies as well, and it does the same thing to them. It can actually decrease testosterone levels. So after the birth of the baby, things are here. Oftentimes women, and sometimes the partner, will try to understand, when do things get back to normal? How long is this going to take? Well, certainly within the first 4 to 6 weeks, most patients should not be returning to some of their normal activities, such as sexual activity and exercise. The body needs time to heal. The body needs time for the uterus to return back to its normal size. So most physicians will tell their patients no sexual activity for at least the first 4 to 6 weeks. And most women do have a follow-up visit with their OB to have an assessment of their status, their health status. So keep that in mind as well. In the first 4 to 6 weeks, your body's in a healing process. So it wouldn't be unusual for you to have a low libido or no sex drive at all. Depending on the type of delivery that you have, you may have had a C-section. You may have a abdominal wound that's healing. If you have a vaginal delivery, and if it was a tough delivery, you may have bruising of the labia. You may have bruising of the whole perineum area. It could be sore. So these kind of leftover symptoms or effects of the delivery could keep you from returning to a normal sex life right after the baby is born. So again, I just encourage you to keep it in mind and understand that the physical changes with your body healing can actually have an impact, a great impact on your libido, and that would be completely normal. So you might be thinking, well, I know, but when, okay, we understand that that's happened, so when does it come back? It's variable. It's variable for each person. It could be within the first 6 weeks. It could take a year to 2 years, depending on if you're breastfeeding, just how you're coping with becoming a new mom, the type of support that you have in that whole process of becoming a new mom. So there's many things that can impact it. The physical changes postpartum or after the delivery of your baby are going to be many. I talked about the uterus. That happens pretty quickly. But some of the lasting changes are going to be even just your bones and the ligaments in your body. Your hips may stay a little wider. Your joints may be a somewhat laxer after the delivery. Actually, during the pregnancy, we produce a hormone that causes this to happen in preparation for the delivery of the baby. So some of those changes may be permanent for you. The lactation itself, if you choose to breastfeed your baby, can make changes in the way you're in your appearance, and especially in the size of your breast. While we know that's a really wonderful thing to do for your new baby, it can also cause some physical changes for you that as you get past the point of maybe breastfeeding your baby, it could have some lasting effects on your breast tissue and how your breasts will look. So part of the reason again that these changes, physical changes, are happening are due to the hormones that were present, and now maybe those levels have changed. The other thing that the change in the hormones can do physically is can cause your hair to fall out. At about around the 3-month mark after you've had the baby, you may notice some fairly severe hair loss. Your hair grew faster and thicker during the pregnancy because of all of the estrogen and progesterone you had. But now that those levels have dropped, your hair will react to that, and typically around the 3-month mark you can expect hair loss. You may look down and see hair on your baby. You may have a handful of hair as you step out of the shower. You may see it in your drain. But don't be too concerned because it will stop, and you'll go into, and as your hormone levels become at a more normal pre-pregnancy state, you'll begin a new regrowth phase of hair. But that is a big change, and for some women that can be quite upsetting and concerning when they see that their hair is falling out as much as it might after the birth of your baby. Because if you are breastfeeding, you could have some issues with vaginal dryness. Again, your estrogen levels are going to be low, which can lead to the issue of vaginal dryness, which then in turn can make sexual activity almost painful for some women. There are remedies for this. There are lubricants that can be used, and again, if this is causing you concern or keeping you from returning to sexual activity, please seek the advice of a medical provider for suggestions on how to help this. Overall, your body image may be shaken just a bit as well, because you might have weight. You may have gained weight during the pregnancy. Initially, right after the pregnancy, you will drop some weight, but then you may have some struggles with losing the baby fat, the weight that you gained during the pregnancy. At this point, it would be important to really take a look and make sure that your nutrition is on par to help you with that. And after you're cleared from your physician, maybe start a light exercise program to help with the weight loss. But again, I urge you not to be too hard on yourself about this. It may take 6 months to a year to actually lose the weight that you gained with the pregnancy, and that's quite normal. The problem with the weight gain, though, is if it's affecting your body image, it could then in turn affect your libido and your desire to be sexual with your partner. So please, try to understand that it's going to take 6 months, possibly a year, for you to get back your natural body shape that you had before you became pregnant. Another hormone that could be affected by the pregnancy and the delivery is the thyroid hormone. And so if some of these, again, I stress, if some of these symptoms persist, weight gain, depression, irritability, it would be really important for your thyroid hormone levels to be checked. You may have a thyroiditis. Pregnancy can cause that. So it would be important to make sure that you seek the appropriate medical treatment for this, which could then in turn help alleviate some of the symptoms that you're having. So overall, while you've accomplished a wonderful, great feat having this baby, the aftermath can be a little rough, and it can certainly affect your libido and your return to the sexual part of your relationship. It's a time of great joy for many people, but then again, it can be a time of fear and concern and worry because now you have this new person to take care of in your life. But the big thing, I think, is to remember that a lot of what you'll go through, the physical and emotional changes, are quite normal. Many of those can be remedied. One of the great remedies is time, the passage of time after the delivery, and also, if needed, actual medical treatment to help you get through those rough spots. I hope that this has been helpful to you. I hope that you understand that there are medical providers who can help you if you're struggling with these kind of symptoms. And I hope that you will seek treatment if you need that.